The second wave of COVID-19 continues to cause more deaths in different regions as more people get infected with the virus.
I don't want to go back to the details of COVID, but in short, this is a respiratory disease. It affects the breathing system of the person. In affecting the breathing system, it also ends up affecting the whole body. So the way you get it is through breathing. So it is through breathing, the air which somebody has breathed from one person to another. It is through touching, such that it can go to touching areas, surfaces where it is, and then you can spread it to by touching mucous membranes. But as scientists, we know that's actually not a very big way of spread. The biggest spread is the person to person through breathing.
In Kabale district, 10 people have lost lives to COVID-19 just in 1 week.
Second, the patients who need oxygen are much more. I called the Kabale hospital, and they said last time we had like 10 patients who needed oxygen. But now there are much more people who need oxygen, and people are severely sick. And actually, as I talk now, we have lost very prominent people in Kabale due to COVID. We lost the former MP, Honorable Manzito Mubwine. We lost a very big engineer, Mr. Nkuru Nunji. We lost the former chairperson of Kabale district, Mr. Patrick Besije Kihwa. And this morning I got reports that so far, in 1 week, we have lost 10 people in Kabale hospital.
Dr. Nicholas Kamara, a member of parliament for Kabaale Municipality, has however appealed the public to be calm and follow the standard operating procedures.
But some people are taking it very lightly. I want people to be at home as much as possible. There is no reason why you should leave your home when you have no business you are going to do. If you have your food, you have gone to the garden and you have cooked your food, just go home and be there. There is no reason of attending a funeral. There is no reason now of attending a party. Parties will always be here, but life, we have one life to live. There is no reason of not following what they are telling. There is no reason of not being vaccinated. Let us be vaccinated. This vaccine has been tested. It is safe. And myself have taken it. Actually, I took it publicly in Kabale Hospital. Let us go for vaccination. People being anxious will make matters worse. Let us not be anxious. Let us help each other. We have phones, that's a good thing. Let us call each other, but don't visit. Don't go and visit relatives that you are now comforting them because they have lost a person. This is not the time.
Dr. Kamara has warned the population against assuming that they have contracted COVID without testing.
Let no one assume they have corona when they have not tested, please. When you get flu symptoms, headache, I get many calls. And people say, oh, I think the way I'm feeling, the way I am having, this is corona, no doubt. No, please. There is no symptom that is very specific for corona. You may have malaria. A friend almost died recently because they had malaria. And when they tested, they didn't have corona, but they had malaria, +3. And now they are okay. So there is no way you can go home and say, now because I was exposed, what? Now I have, no, please. The first thing you do is tests.
Self-medication is also another challenge doctors are warning against.
Once you find that it is positive, follow what your doctor is saying or your health worker. Don't treat yourself. Don't go to the pharmacy and buy drugs. You don't know these drugs, and you don't know whether it is mild or moderate or severe. Don't go and treat yourself. And even among the elite, people are treating themselves. It is very dangerous. These drugs are poisons. You are going to overdose yourself and then be sick of, you find that you need the kidney transplant in the future.
Still in Western Uganda, Bundibujo district leaders are concerned about the refugees crossing from neighboring districts.
COVID is too much in Congo than in Uganda, and these refugees are entering Uganda using porous routes, the legal routes, and they are not being tested. Neither are they being registered. So unless leaders, local leaders on the ground, and some of us, unless we become vigilant enough to ensure that we mobilize them to go to one place, like we have done it, that the refugees who are entering Uganda through these porous routes should directly go to the transit camp.
At house level, parents and guardians have been advised to ensure that their families are protected.
Minimize movements. In our villages, there is a big problem of free range. We live, now that the children are out of schools, you will find there is no control. You will find that these children are moving a lot to see their aunties, their uncles, their what. This one must be minimized. This one must be stopped.
The second wave of COVID-19 has caused more deaths and infections, with the test positivity rate now at 21.5%. Adiana Kute, UBC.